Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kabas Jehangir, and today we're talking all hands. Today I've got the super Dr. Abhijeet Wahegaonkar, who is a hand surgeon amongst, many other things, but it's a very specialized thing. So thank you so much for being here, Doc. Appreciate it. We're talking about everything hands and, well, I suppose everything up to your elbow today, perhaps maybe a little bit higher. But thank you so much for being here.
Well, good afternoon, and thank you so much, Kabas, for having me here on this exciting podcast. And I think this is such a wonderful kind of a endeavor to reach out to people and talk to them in an informal way about conditions that affect the hand and the upper extremity,
Right.
and maybe about some tips and tricks to take care of their hands.
Absolutely. And that's the thing, because I mean, a lot of people don't think super speciality into hands or anything like that. The common ones are the shoulders, the knees, the elbows are the big ones, so to speak. But I thought it'd be very interesting to speak to you particularly about hands. So
And I really appreciate that. Like you rightly said, a lot of people know about spine surgery, they know about
yeah.
hips and knees, they know about shoulders. But a lot of times people don't even know that there is a subspecialty of hand surgery. And it's very striking because my wife was was preparing for a PhD, and her guide, who is a very well educated and a very highly reputed professor, one day asked her, "What does your husband do?" And she said, he's a hand surgeon. He was astounded as to what
that
is a
is.
hand surgeon. So, thank you for having me on this podcast.
Right,
And
absolutely.
I hope this will go a very long way in helping people identify whom and where to reach for any condition that they may have regarding the upper extremity and the hand.
Yeah, well, maybe you can give me a hand there.
Yep, absolutely. Yeah.
Well, let's start with that. I mean, because the first thing I would think of as a layperson, hand surgery would be generally trauma related. Someone's banged it or it's become run over or, banged it through a door, whatever it is. That's the first thing I think of when I think hand surgery. But can you give us the kind of most common things that you see, whether it's from the trauma side or whether it's ailment related, arthritis? What is the most common things that you see and need to deal with?
Sure, absolutely. So, yes, trauma does form a very large chunk of the field of hand surgery. However, that is not the only problem we encounter as clinicians and specialists. So, when we talk about trauma, it could either be a blue collar job or it could be a white collar job. More often than not, the trauma that we imagine or we are facing in the blue collar jobs are related to mechanized setups. So, having fingertip injuries or a crushed hand, or maybe some kind of a ligament sprain or injury, are what we see. Sometimes they can be very gory. It could be a totally crushed hand that gets entrapped in moving parts.
Yeah, see, that's what I think when I first think hand
Very true,
surgery.
very
Yeah.
true. Or it could be even domestic and household, like, homemakers using a mixer, or you're chopping vegetables and your finger may get chopped, so on and so forth. So these are the hand injuries that often come to mind
Yeah.
when we talk about the actual injuries. You know what? It's very surprising, especially in today's era where we have desk jobs, where people are sitting at one place, or even homemakers, for example, when they are working with their hands in front of the body, continuously being seated with an awkward position of the hand that can lead to a lot of pain in the shoulder, in the arm, in the elbow, in the wrist. Usually, a sensation of heaviness or tingling numbness, pins and needles, pretty much like you sit cross legged for a little while and you may have numbness in your feet.
Yeah, like I'm doing right now. actually.
Exactly,
So,
right? So if you sit with your, or add to it the brunt of the cell phones. You're scrolling, you're browsing social media, you're on your cell phone for a long time.
yeah.
Nerves get stretched, they get pinched, and that leads to a lot of pain. So that's what we encounter as repetitive stress injury
Yeah.
in white collar jobs. However, leaving trauma aside, we see a lot of little kids, little children,
Okay.
who may have deformities of the hand, like no thumb at all.
So someone was
Fingers,
born with something like that. Okay.
correct. Or it could be the fingers stuck together, no fingers, or a thumb that is smaller than normal.
Yeah.
Or maybe they may not have any limb from wrist on or
Yeah,
maybe
yeah.
the elbow on. Um, During delivery, they may land up with weakness of the upper limb, which is called as birth-related brachial plexus injury. And there is such a large spectrum of these problems. Deformities of the finger, of the wrist, of the forearm, hand, elbow, shoulder, so on and so forth.
Yeah, yeah.
Or it could be the other end of the spectrum where you have elderly people with arthritic conditions. You must have heard of knee arthritis. When
Right.
we
Yeah,
do
yeah.
a knee arthroplasty, you may have arthritis of the thumb. You may have arthritis of your finger joints. You may have arthritis of the wrist. More often in people with rheumatoid arthritis, for example, right?
Yeah. Well, sorry to interrupt you. Now,
No, 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 no. Absolutely.
I had chikungunya, so I can tell you firsthand that I experienced that, and you really don't realize the value of having healthy limbs
Absolutely.
until it's impaired
Absolutely.
or affected.
You know, there's an old adage that says you never understand the value of health till you lose it.
Yeah, absolutely.
Right? So it's hand health, and pretty much like any other problem, your hand may cause a lot of problem because it is your organ by which you will perform tasks and activities that you conceive
Yeah,
in your
absolutely.
brain.
Yeah.
Right? Um, so coming back to the question you asked me, other than children and older age group, you may have sports injuries, for example. Ligament injuries are more commonly dealt with by sports injury surgeons related to the knee and the shoulder, but it might surprise you, more than half of these injuries may also involve the wrist
Yeah.
or the thumb or the fingers. You may have tumors of the hand and the upper limb that may be benign or malignant.
Okay.
So it's a very vast
Yeah,
spectrum,
yeah.
as you would understand. And I don't like to look at hand surgery as a super specialty,
Okay.
but more of a subspecialty of orthopedics, plastic, and microvascular surgery. So you combine all of these, and that's how you become a hand surgeon.
Okay. Well, that's pretty fascinating. Just quick aside, how did you get into this?
Oh, very interesting question. So, I think this goes back to the days when I was a young orthopod and just out
Right.
of medical school, and I was working for leprosy.
Okay.
And I was doing more of lower limb surgery, and then I was also kind of exposed to upper limb surgery. And that is where I realized the importance of the human hand in terms of function
Yeah.
and touch. You remember, I mean, I'm sure you must be knowing that leprosy is still looked upon as a stigma.
Yeah.
A lot of these people are treated as outcasts. But when you touch these people who have not experienced a human touch in a very long time, in particular, I remember one patient who I had operated upon, and I just put my hand around his shoulder, asking him how is he doing, and he burst out in tears, telling me that he hadn't experienced a human touch of compassion in more than 20 years. And
Incredible.
that kind of really struck a chord in me, and I thought that I would perhaps train in hand surgery and devote my career to the treatment of problems related to the hand.
Well, that's a lovely and deep way to
Thank
get
you.
involved in that. And I can imagine that really shows about why you're so passionate about it, because it's
Thank you.
come from such a powerful place.
It indeed was a life turning and a life changing experience
Yeah,
for me.
absolutely. And as you said, it's something that people don't think of,
True
hand
that.
surgery. So that's quite fascinating, actually. But coming back to the ailments and the trauma side of hand surgery, obviously people can't do anything really to be preventive per se on the trauma side. It can happen, it can't happen. It's luck of the draw. You can be careful, not careful. But on the other side, we're talking about nerve-related things or disease or deformities and that side of the thing. What are the kind of preventive things that you would look at for, as you said, you used the phrase hand health. So what are the kind of key preventive things that one could look at from that standpoint?
Great question, Kavas. Thank you so much for asking this. And I think prevention is better than cure is something that we all hear and we all know of,
Yeah.
but we seldom pay attention to.
Right.
And I think one of the best ways to avoid injuries is just to follow the safety precautions.
Yeah.
Every industrial setup will have a set of safety precautions. And if we are mindful and we adhere to those precautions, I think a lot of these injuries can be prevented
Right.
at the get-go. For example, avoiding wearing loose and long sleeves with moving machinery,
Okay.
being alert when you are working, not being kind of working, not working when you're feeling drowsy, for example. Or, for example, wearing protection gloves when you have hot surfaces
Yeah.
like
Yeah.
plastic molding machines or you have moving machinery. One of the commonest injuries that we see today in modern society are sugarcane crusher injuries, right?
Okay.
You love to have your glass of sugarcane
I see.
juice,
We're in roadside
correct?
ones where you see the sugar
Absolutely.
canes going in into the
It's
gears.
appalling and heartbreaking to see young individuals who are making a daily living
Yeah.
by
Yeah.
working on those machines have their hand go into the
Yeah.
crusher.
Yeah.
And it's a very simple thing. There are now devices and machines wherein these injuries can be prevented by having that equipment wherein there is no possibility of your hand going into the machine.
Okay.
So simple things such as
Yeah.
these. Or coming to the other end of the spectrum where I mentioned about the white collar jobs,
Yeah.
when people are sitting at a desk having frequent breaks, taking frequent breaks to stretch, to avoid working in an awkward
So you
position.
can actually stretch your
Absolutely, or even your elbows, your shoulders, a simple stretch.
right.
Getting up and walking a little bit,
Yeah.
right? Or you kind of have an ergonomic posture when you're working at your desk,
Desk.
having your shoulders too slouched or
Right.
shrugged,
Right. Right.
not having support for your elbow for
Wrists,
that
okay.
matter. Fun fact, would you believe that uh, an average person who's working at an IT desk or an IT job would walk on his fingers for about 4 miles a day?
Oh, that's a very cool fact. So
Absolutely.
you're saying that when their fingers move, they're walking 4 miles. So does that count towards their step count?
Exactly. So that's count that some funny statistics have been kind of elucidated, taking into the
So 4 miles, so
yep,
roughly
that's
6 kilometers. Yeah, that's a good day's
a good day's
exercise.
workout. Yeah. If you were to walk 4 miles, that would be enough exercise for your heart and your legs.
Yeah.
Imagine these tiny fingers
Yeah, exactly why I
doing
asked
that
you whether
work.
it counts towards your step count or not.
and at the rate at which you type.
Uh-huh.
So can you imagine all of that stress coming on to your ligaments,
Yeah.
to your joints, to your nerves? So it's going to add fuel to the fire over a period of time. So we call this as a repetitive stress injury.
Okay.
Essentially, imagine a drop of water that keeps on falling on stone would end up cracking the stone. This is the human body.
Yeah.
So the same activity, when it is being done repetitively
Right,
over a period of time,
Death by 1,000 cuts.
voila. So that's going to happen. Other than that, I think at home, for example, homemakers can be a little cautious when they're using uh, appliances like mixers when they are cutting and chopping. Being mindful is perhaps the best way of preventing injury.
Right.
I hope I'm able to give you
No,
that
absolutely.
sense of
Yeah, absolutely.
message.
Because another thing, because I've been reading a lot about, I enjoy my exercise and so forth. Luckily, not so much on my fingers as perhaps a lot of IT professionals. But one of the things I've been reading about lately is this concept of grip strength. Of course, everyone knows the importance of it. As you grow older, the longevity and the requirements of how important it is to have that, grip strength. So, various exercises to do that, to make sure that stays good. But apparently, maybe you can be the right person to talk about this, is that apparently now grip strength is sort of becoming a good metrics for someone's longevity and their health. Is that something that you're starting to see or people need to be focused on?
Well, I don't know if there is any good evidence to link the grip strength with your longevity. There are different other parameters,
Right.
but it's a feel good factor. A lot of times because this is perhaps one of the most tangible ways of determining how good your strength and your prowess is.
Right.
So yes, perhaps if you have a good upper limb strength out of calisthenics, out of doing some routine exercise,
Right.
having supple joints and strong muscles around the upper limb, Yes, perhaps it's a good metric
Yeah.
of your overall health.
Right.
But honestly, I don't know if it's
Okay.
related
But
to
are there any
longevity.
particular exercises that you recommend for hands just as an exercise?
Yep. So you could use these small therabands. You could use these exercise balls.
Those stress balls.
Correct.
Yeah.
You have these gyrometers, for example, gyro balls, wherein you can build up your wrist, forearm muscle strength just sitting in your office. They're very light, but when you use them,
Right.
it kind of acts as a gyroscope and it gives you that momentum and kind of a inertia against or resistance against your movement.
Yeah.
And that is also very helpful. You may use those spring loaded
Yeah.
strengthening,
I've used those. Yeah.
right? Yeah.
It feels good.
Correct. It feels good. And you may use for elderly people who have arthritic problems.
Yeah.
Maybe they could just soak a napkin in lukewarm water, tepid water,
Okay.
and gently kind of squeeze that napkin.
Okay.
So that will help the heat dissipate deeper into the tissues, moist heat, and maybe not have a very high demand on your strength. So suppleness to prevent stiffness
Yeah.
and strengthening to be able to perform your activities in a more meaningful manner
Right.
are perhaps the way in which you can keep your hands functional, strong, and healthy.
Okay. Any myths that come to you that you feel that you always need to debunk when people come to you? Like, for example, I mean, fingers that have a lot of joints.
Correct.
People say have ghee; it's good for your
Yeah.
joints, which may or may not be true. But I'm just citing an example.
True. Or maybe if I put the words in your mouth, cracking your knuckles, right? I think that's perhaps the most common myth that
Yeah.
people
Oh, yeah, that's a
talk
good
of,
one
correct?
because I do that a fair amount as well.
Right. So even I crack with knuckles, and so much of confusion surrounding this fact whether you should crack your knuckles or not. Well, first and foremost, the first most important thing to know, it's not harmful. Maybe annoying for people who are sitting around you. When children do it to their parents, if you're in a boardroom, maybe to people around you, but it's certainly not harmful. There is a nitrogen bubble that forms into the joint fluid that bursts and that creates that popping noise
Yeah.
or
In fact,
cracking
it's
noise.
relieving.
It is relieving.
Yeah.
But other than that, people have a lot of questions regarding the diet that they should follow,
Good. Yeah.
right? Especially if they have arthritis or if they undergo a surgery, whether they should consume a particular kind of food or not, or if they have arthritis, again, are there any restrictions, dietary restrictions that they should adhere to? Well, if you kind of think about it from a holistic perspective,
Yeah.
people say foods which will aggravate your arthritic problems.
Inflammation and
Correct. And inflammation should be avoided.
yeah.
So that is, but it doesn't specifically apply to only your hand joints. It could be for your entire body. And then a lot of times people ask if after surgery you should eat more of meat and proteins
Yeah.
or calcium intakes. Well, I think it is best that you consult your doctor. There is no such, you know, inhibition or a need to either consume more or completely avoid anything of that sort. So it is best to kind of counsel, seek the advice of your specialist to answer these questions.
Right.
Right.
Okay.
Yep.
Any other interesting? This fact that you told me about the 4 miles walking is still playing on my mind. I've never heard such a cool fact.
I know. Well, I think a few things that I would really like to share with you is the fact that Albert Einstein once said that next to the brain is the hand, which is the most important organ in the body. And if
you actually consider it an organ, huh?
Yeah, it is an organ. And think about it. Whatever it is that you conceive in your brain, you're able to execute it with your hands. For example, a sculptor would have the image of the sculpture that he wants to create, and he does it with his hands. A painter, an artist, a surgeon. So the hand indeed is such a complex, such an evolved organ of the body. And we are on top of this food chain because of the dexterity of our hands. If you were to see the thumb, for example, is so evolved when it comes to opposition. We are
Yeah.
able to perform activities of great strength as well as precision and dexterity. And this particular joint is called as a radial ulnar joint.
Right.
And we are able to rotate our forearms. So these two joints place us on top of the food chain.
Yeah, in fact, I was going to mention that. I think one of the most important things in terms of evolution for humans has been the use of the thumbs, from what is
Absolutely.
sort of differentiated us from other primates.
Correct. And the sensibility in the hand is the highest in and
mean
as
the-
compared to
You mean the finesse and the
Correct.
ability to touch
so
each sense?
yep. So the greatest representation in the human brain cortex is for the hands
Okay.
and the thumb in particular.
Right.
So you can understand the importance of this when it comes to these neural links between the brain and the hand. And it's very fascinating that we have such a complex organ at our disposal.
Yeah.
And we tend to kind of take it for granted.
Yeah, absolutely. You don't think
And
about
yep, it's amazing that it's like a rabbit hole that gets deeper and deeper. The more you delve into this field, it could be an artist, it could be dancers,
Right.
it could be the mute trying to speak with their hands.
Yeah, that's a good one, man.
It could be the blind reading with their
Braille.
fingertips, the braille. Surgeons performing complex surgeries.
Yeah.
The human touch. You shake hands, you touch, the mother's touch, the friend's touch. So there's so much in terms of communication, gestures that we do.
Right.
The hand, perhaps, is an amazing and an absolutely fascinating organ of the body. And I encourage and I would really like to send out this message to our viewers
Please.
to the next time you use your hand, think about this gift that you
Yeah.
have. And fun exercise, try to tuck in your thumbs in your palms
Okay.
and try and tie your laces.
Okay.
Do your buttons.
I can't even think about
I
that.
can't even think about
Yeah.
it. So we take things so much for granted.
Yeah.
We are so, kind of at times, well, I won't say negligent, but we take it so much for granted. We
Yeah.
tend to overlook the possibility of injury. The second thing I really want to, kind of emphasize and tell our viewers is that even if it's a minor problem,
Yeah.
even if it is something that may seemingly be very frivolous,
Like, for example, what would be minor?
just a
Just
nagging pain,
Yeah.
pins and needles,
Right.
if it's not going away,
Yeah.
please seek the advice of an expert.
Hmm.
It may take a little bit of your time, but then you're assured that
Yeah.
it is something that is not going to nag you and bother you. in the
Before it
long
can
run.
really become a problem.
Exactly. So do not, be kind of very so with your internet searches and
Oh, the Dr. Google.
Dr. Google. Seek out. You may use the Google to find out who is a hand specialist in your area.
Yeah, or just watch this podcast.
Exactly. Or watch this podcast.
This particular episode.
Absolutely. And I think something which is such a commonplace and very obvious organ which is visible to the
Yeah,
eyes
yeah.
is such a marvel of evolution and such a marvel of our dexterity.
Yeah.
Thank you so much for
Well, thank you, Doc. I mean, it's been fascinating hearing from you on all these aspects. I don't even know where to start or where to end, but we can keep going. But it's been absolutely thoroughly fascinating hearing from you from this particular aspect where people really need to hear more about. And as you said, just be a reminder to be grateful for.
our
hands.
health. Absolutely, and our hands. Thank you so much.
Thank you so much for being
Have
here,
a
Doc.
good day. Thank you.
Thank you all. Look forward to seeing you in next week's episode. But before we leave and before you leave, please don't forget to hit the like and subscribe button at the bottom and please share this with everyone. Thank you.